The headline commitment to 5.9 billion for the NHS over the next few years is obviously going to be welcomed by the sector. That includes 3.4 billion in future years for investment in digital transformation, which has got a huge opportunity to really transform the care that patients receive. But the immediate will be the 2.5 billion next year for immediate revenue pressures. And what that I think reflects is that the day-to-day issues around kind of industrial action, pay disputes, and the kind of level of demand that the NHS is facing is really crowding out some of these bigger, longer-term investments that we might want to make. And if you look at particularly next year, the department's revenue budget is actually higher than the previous autumn statement. However, the capital budget is slightly lower. And again, you're seeing this balance between now and the future really shifting to what's needed immediately. And I think that really came across in the wider budget as well. We saw a lot of focus on productivity, about kind of getting more out of the resources that we have available, but much, much less on prevention. There were kind of a handful of mentions through the budget. And what you'd like to see over time is probably a commitment to a slightly longer term multi-year focus, where you can really start to change the nature of demand for public services and change the support that people have to lead different lives that mean they have less need for things like healthcare or criminal justice or some of these more reactive ends of the state, which will require us to work in a very different way, but is very much going to be the direction of travel that we'll want to take in the future.